Okay, so we're being recorded and various professionals may be on the call. Please do not divulge any identifying or confidential information about survivors. If you've been on the last couple of calls with us, you might be able to recite these housekeeping things by heart. Another note, please speak one at a time and not too fast so that the captioners and ASL interpreters can follow along and so that everyone can participate. And then I already talked about the attendance. Type your name and program, your full name and program into the chat or email me afterward if you are joining us only by phone. So Luana had a last minute emergency this morning. So she was going to be facilitating this meeting, but I am here in her place. And so I think that's all the housekeeping that I had. If there's any other information that Luana wanted to pass on to you, she will send out a separate email. So good morning. Thank you to Erica and Damonte for joining us today from the ACLU of Iowa. I will let the two of you introduce yourselves and talk a little bit. I know you have a presentation, so talk a little bit about what your organization is doing to support the rights of incarcerated people in Iowa, and then I'm sure we will have a lot of questions for you. All right, can you unmute yourselves? There you go.
Awesome, yes. Hi, thank you very much. I'm going to go ahead and share my screen with the presentation here. Is that working? Can everybody see the presentation? Okay, great. So thank you so much for having us. We are going to talk to you a little bit today about the COVID-19 outbreak and the criminal legal system and some of the work that the ACLU of Iowa and along with some of our partner organizations have been doing to advocate for people who are incarcerated during this time. My name is Erica Bars. I'm a community engagement associate with the ACLU of Iowa. My pronouns are she, her, and hers. Damonte.
Hello, how you guys doing today? My name is Damonte Stogner. My pronouns are he, him, his. I'm also a community engagement associate at the ACLU of Iowa.
Awesome, thanks. And just before we get started here, please keep yourself muted throughout the presentation, and then we're going to have, if you have questions, you can feel free to put them in the chat, and we'll get to them at the end. Please hold all questions until the end. So just to tell you a little bit about the ACLU, first and foremost. So the ACLU of Iowa is an affiliate of the National American Civil Liberties Union. There are affiliates in all 50 states, Washington, D.C., and Puerto Rico. Our Iowa affiliate was founded in 1935. We were actually the 5th affiliate in the entire country. We are a private, nonpartisan organization whose mission is to protect and advance the civil liberties of every person in our state. And when we say every person, we truly do mean every person. We have a few different ways that we go about doing that work. One way is that we work in the Iowa legislature, both to promote policies that do defend the civil liberties of Iowans, and also to defend against any legislation that has the potential to infringe on the civil liberties of Iowans. One example from this session of something that we've been working on, HJR 14 is a constitutional amendment that, if it's passed, would restore voting eligibility for people with felony convictions after they've completed their sentence. Right now, Iowa is the only state in the entire country that still permanently disenfranchises people with felony convictions for life, regardless of whether or not that they've completed their sentence. So we have been working to support that piece of legislation and right that wrong, and make sure that Iowa isn't at the bottom on that issue by pushing for that constitutional amendment. Another way that we work to fulfill our mission to protect and advance civil liberties for Iowans is through the state and federal courts. This is perhaps the wing of our work that people are most familiar with, both in Iowa and with the ACLU more broadly and across the country. Our legal department takes on cases specifically geared towards establishing constitutional precedent that upholds the civil liberties of Iowans, and also defending already established constitutional precedent that defends the civil liberties of Iowans. So one example of that area of our work, and forgive me if I get the timing on this slightly wrong, I think we can all empathize with time being kind of a dubious concept right now. But a couple of weeks back, when Governor Reynolds announced a ban on surgical abortion in response to the COVID-19 outbreak, the way that she initially articulated that ban made it seem like it was defying constitutional precedent that had already been established through litigation that the ACLU had pursued previously, that establishes that Iowans have a constitutional right to abortion. And so we filed a lawsuit in response to that ban, and have come to an agreement that the ban is not, like as it was initially articulated, has not gone into effect, and are still working through that lawsuit. So that's one example of our work in the courts. Another wing of our work is public education and advocacy. So presentations like this, Damonte and I, when we're not in a period of social distancing, travel across the state to present to organizations and groups of Iowans about work that the ACLU of Iowa is doing. We also have a special series of presentations that we call our Know Your Rights presentations, where we are specifically aiming to make sure that Iowans have the knowledge that they need to be able to assert their own civil liberties in a variety of different situations. One example of a presentation that we did a couple of months back, Damonte actually presented to a group of Kunama refugees who had just recently arrived in Iowa. We set that up through Embark and talked to them about their rights if they ever had to interface with law enforcement officials or ICE. So that's one example of some of the work that we do in terms of like public education. As you might imagine, because our goal is to protect and advance the civil liberties of everyone in our state, we work on a large swath of issues. This is not an exhaustive list by any means, but some of the things that we work on include freedom of speech, racial justice, LGBTQ rights, student rights, privacy, open government and open records, reproductive rights, religious freedom, immigrants' rights, women's rights, criminal justice reform, voting rights, and a whole host of other things. And with that, I'm going to pass it over to Damonte, who's going to talk through talk you through a letter that we recently sent to criminal legal system officials, both on the state and local level, sort of detailing some of the recommendations that we have for policy shifts that need to be made in order to protect the health and safety of everyone who is incarcerated and anyone working in those facilities and Iowans as a whole. So take it away, Damonte.
How you guys doing today? Again, I'm Damonte, Iowa ACLU. So I just wanted to talk to you guys a little bit about the COVID letter and, some of our advocacy work around the criminal justice system and during this crisis of COVID-19. As we all know, COVID-19 has had a tremendous effect on our personal lives, our public health, and our economy. The ACLU is here to protect the civil liberties of all Iowans, including those underserved and those underprivileged and vulnerable populations. We know our state has had a history of criminalizing certain activities, so the ACLU took a collaborative approach with 25 other organizations across the state to draft this letter, to draft to urge some recommendations to various personnel across the state of Iowa to take a closer look at this. We thought through, Erica, you can go to the next one. We thought through protecting the health and public safety of all Iowans and decided collectively to urge these recommendations to ensure the health and safety of all individuals involved. One of the biggest action pieces is to dramatically limit and reduce the amount of individuals who come into contact with the criminal legal system. So we're asking police and prosecutors to basically use their discretion that they already have to reduce these numbers. Let me talk to you a little bit about a few recommendations in the letter. One of the biggest is for the criminal justice system, the sheriffs and the DOC, is to implement non-punitive procedures for housing people who are exposed to the virus, who are at risk of the virus, or who test positive for the virus. So normally, if you get sick in jail, or if you need to be quarantined, you would be quarantined in a single cell by yourself. But we're asking to not implement those punitive policies because we know a lockdown is not a answer to helping a person to recover through this. And again, there's no prolonged widespread lockdowns, any lockdowns or interruptions in regular activities at the jails or prisons, such as exercise visits or calls with families or attorneys, should be based on science and be limited as much as possible. The recommendations that we are highlighting are to protect not only the incarcerated population, but also the workers and the public who come into contact with this population on a regular basis, and ensure the basic freedoms are all still intact during this virus, or during this crisis. Sorry about that. We're calling on county sheriffs who are in charge of local jails to provide and ensure that there's still adequate communication between family members and supporters. We're asking that all legal visits and professional personnel not be curtailed. So please, again, just allowing those professional visitors, lawyers, and personnel who are advocating for people who are incarcerated to continue to visit them and work on whatever projects they were working on before. We're asking that staff members are educated and have the proper tools to ensure a healthy, hygienic environment. So making sure that they're checking in and understanding the risks associated with constantly having to have this place sanitized and clean it, and ensuring that that's done on a regular basis. We've also asked the Board of Parole and parole officers to take a look at how they are doing their jobs. So we're asking them to limit the number of people being incarcerated by suspending detainers and incarceration for technical violations or technical rule violations. We're asking the parole board to expedite and expand release opportunity for incarcerated individuals to just reduce the population in prison as recommended by health experts. We're really calling on the governor to use her power and her role to help stop the spread and limit the harm it inflicts on our communities by decreasing incarcerated populations and creating a culture in which transparency and safety and health for all people are at the paramount of our concerns. And we're just asking her to grant immediate commutations to anyone whose sentence would end in a year, or to anyone currently being held on a technical violation, or anyone identified by the CDC as particularly vulnerable to be able to contact this communicable virus. Again, we've called on the governor's office. We're calling and asking for transparency around this COVID-19 crisis. We're looking to help mitigate the spread of the virus. So having this data and understanding who's being affected is really helpful to that cause. And obviously this isn't the whole letter, but there will be a actual link to the letter in the chat box. So Erica's going to talk to you guys a little bit more about what you can do.
Awesome. Thanks, Damonte. And just on the link front, there are a few links that we're going to be sharing with you, and I'm planning on dropping those all into the Zoom chat once we reach the end of the presentation. So you'll be able to peruse those after we've gotten done presenting. So Damonte just went over some of the recommendations that we have sent to state and local officials in the criminal legal system. And there are actually ways that you can help us to make sure as many of those recommendations are implemented as possible, to keep people who are incarcerated and anyone within those facilities safe and healthy during this interesting time. One thing you can do is actually contact these officials and advocate for people who are incarcerated. Just to go through briefly the list of people this letter was sent to initially, that includes county attorneys, county sheriffs, the Iowa Department of Corrections and State Prisons, the Iowa Board of Parole, and the Governor's Office. As victim service organizations, you do have a uniquely powerful voice while you're doing this. You have the potential to help these officials understand that these recommendations and these policy asks help you to be better able to serve your clients who are incarcerated and help to keep those clients and those people who are incarcerated safe and healthy during this time. Another of the links that I'll be dropping into the Zoom chat is a web page on our website that specifically lists out all of the contact information for all of these groups of people. And we also have drafted some sample questions that would be good to ask each of these individual groups of people to sort of help you suss out what their position is on some of these recommendations. See if they've already implemented some of these, if they're possibly like working through how to implement some of the other recommendations. Just some questions to sort of help guide your conversation with these officials. Something else that you can do is contact your local media and encourage them to cover COVID-19 conditions in local prisons and jails. Again, as victim service organizations, you bring a unique story angle to this that it's possible that your local media have not considered up until this point. Even if they have already done some coverage on COVID-19 conditions in local prisons and jails, you bringing your voice to the table has a powerful effect and can help make sure that that coverage continues. And that press coverage helps those officials to be held accountable and encourages them to take further action to protect the health and safety of the people in their charge. So something you can do is you can share the letter, which I'll, again, dropping the link into the Zoom chat after this presentation is over. And I'll also drop a link to our press release about the letter. And you are free to share both of those documents with any local media that you have relationships with and want to encourage to cover this. A couple of things that you can ask your local media to report on. Ask them to report on confirmed and suspected cases within these facilities. And you can also ask them to report on how many people have been quarantined and under what conditions. And I think Damonte alluded to this earlier, but just to be extremely clear, solitary confinement is not an acceptable method to medically quarantine folks. And there's a few reasons for this. One, solitary confinement is just extremely psychologically damaging. And it's essentially punishing people for getting sick. And it discourages transparency among people in the facility. So for example, if someone knows that, if someone is experiencing any symptoms of COVID-19 and they know that if they share those with a staff person, that there's the potential that they could be put in solitary confinement as a result, it makes them less likely to share that information and could put everyone at risk, because then they're more likely to actually spread the virus further within the facility. Something else that you can do is actually contact us. We are closely monitoring state and local officials' response to this letter and to these recommendations. And one of the most useful things to us as we're doing that is knowing how conversations with state and local officials are going. And that helps us to determine what their positions are, possibly any new policy shifts that are coming down the pipeline. And you can let us know how your conversations with those officials go by reaching out to us at outreach@ACLU-IA.org. Additionally, if you have clients who are incarcerated and their civil liberties are being violated in the midst of this outbreak, we want to know about that too. And specifically our legal department wants to know about any of those things that are happening. And you can contact our legal department at legal.program@aclu-ia.org. And something else that I will drop into the Zoom chat after this presentation is over is a webpage on our site that specifically details how the best and most effective way to contact us and contact our legal department about a legal problem or about a civil liberties violation. As you might imagine, our legal department is pretty busy, and just those tips on the website will help make sure that your request is reviewed as quickly as possible, and that you're able to get a response as quickly as possible. Luana had mentioned that one of the top questions on all of your minds was, what's next? Where do we go from here? So I wanted to make sure to touch on that. Like I mentioned before, we are continuing to monitor state and local official response to our letter and to these recommendations, and monitoring any policy reforms and shifts that happen as a result. Something else that I will drop into the Zoom chat after we're done presenting is a map that the Justice Collaborative has developed, which is actually monitoring all of the criminal legal system policy shifts that are happening as a result of COVID-19. And you can just click on the state of Iowa and sort of see what policy shifts have been made by going to that map. So I'll be sure to drop that in the chat after this. Something else that I wanted to be sure to mention, just yesterday, we, along with 36 additional organizations, including the Iowa Coalition for Collective Change, sent a letter to ICE officials who are in charge of monitoring ICE activity in the state of Iowa, urging them to make some policy shifts and policy changes in response to the COVID-19 outbreak. A couple of examples of some of the recommendations that we made in that letter include asking them to halt all new ICE detentions and release people who are already being detained by ICE in Iowa jails, beginning with people who are the most medically vulnerable. That includes people who are over the age of 50, that includes people with pre-existing conditions, and etc. We also have asked them to completely suspend ICE activities at medical facilities and other sensitive locations. They've already done some lip service speaking about how they are going to implement that, but we are urging them to be more proactive and really hammer the message home that during this time of crisis, they are not going to detain people for attempting to seek the medical care that they need. We know that, like, immigrants and particularly Latinx folks trying to fear going to seek medical care in some of these facilities because they fear being detained by ICE. And we can't have that during this pandemic. We need everyone who is able to seek care needs to be able to. We are also continuing to push for more expansive race and ethnicity COVID-19 data. So earlier this week, the Iowa Department of Public Health began releasing data specifically around race and ethnicity for people who have tested positive for COVID-19. That result was largely thanks to work that the NAACP and LULAC Iowa have been doing in urging the Iowa Department of Public Health to take that step. And we're continuing to push with them for more data. There is more data with race and ethnicity with COVID-19 that needs to be released. One example is that the Iowa Department of Public Health has not yet released race and ethnicity data for people who have died in Iowa as a result of COVID-19. So that's an essential piece of data that needs to be released. And another is that they have not released any meaningful race and ethnicity data around who is actually being tested and who actually has access to testing. And these are both extremely important metrics because we know already as a result of the data that Iowa Department of Public Health released earlier this week, that Black and Latinx Iowans are being impacted by COVID-19 at a disproportionately high rate. And the more data that we can gather, the more that is publicly available, the more that we can urge state and local officials to take concrete, actionable steps in order to fix those disparities and make sure that no one is being disproportionately impacted by this virus. Just in general, if you want to keep up with the work that the ACLU of Iowa is doing, you can sign up for our email updates. Both, if you go to our website, right at the top, there is a way to fill in to get email updates from both our affiliate, the ACLU of Iowa, and then also updates from ACLU National. So you can stay up to date both with what's going on with the ACLU here in Iowa and also all across the country. We also, on our website, you're able to sign up for our rapid response form. This is our specific email list that is geared towards our legislative work. So we use that list to update people about our legislative priorities and also provide opportunities for people to get involved and help us make those legislative priorities a reality. I also just encourage you to follow us on social media. Our communications department does an excellent job of keeping our work up to date and informing the public about our work through social media. And we're on Facebook, Twitter, and Instagram. And in those slides, those are our handles on all of those platforms. That is all we had in terms of content. Our contact information is here on the slide. I'm going to leave that up for a little bit, but then I'm going to stop screen sharing so I can drop those links into Zoom, and we'll also start to take questions. It looked like a couple might have been dropped into the chat, and then we can just continue the conversation from there. Thank you, everyone.
Awesome. Thank you, Erica and Damonte. That was very informative. Yeah, so while Erica is putting those links into the chat, please feel free to either unmute yourself and speak up with questions or put questions in the chat. I see Gretchen has said, I can't clap enough. Thank you all for your efforts on behalf of people in detention. So kudos.
Thank you.
Thank you all for your efforts as well. I mean, I know this is a tough time that we're going through, so everyone's trying to put their head together and resources and trying to figure out the best practices and the best way that we can serve, one of our most vulnerable populations. So again, I'd like to extend the thanks out to you guys and the hard work that you're doing on your ends as well. Thank you all.
Yeah, I see a couple people also saying thank you in the chat. So lots of that sentiment. Awesome. Any questions for folks? And I know, the work that you all do at the ACLU is more systemic, and a lot of the work that, advocates who are on this call are doing is more individual. And so great to see the connections between those two and how we can support each other in doing that.
Yes.
Absolutely.
And then I see also Nadia from IowaCASA has joined us. Nadia, would you mind introducing yourself and talking about your connection with the issue that we're talking about today? Is that okay?
Yeah, definitely. Hi, everybody. My name is Nadia LaFontant. I work for the Iowa Coalition Against Sexual Assault. My position is the Underserved Advocacy and Training Specialist. There's a lot of stuff, a lot of responsibilities under that, but my main connection with this topic is that I work with the Prison Rape Elimination Act, or PREA. I work with the Iowa Department of Corrections and all of the correctional institutions throughout the state of Iowa to help them come into compliance with those federal standards. I assist with their training for staff around PREA, as well as relationship building with those institutions and local rape crisis centers so that advocates can provide support and services to incarcerated survivors, as well as support groups and programming.
Awesome, thank you. And thank you for joining us today to offer your perspective as well. Is there anything that you want to add in terms of information that you've heard from your contacts, or information that you feel like would be important for advocates to know?
No, I feel like everything was covered. As I've been talking to advocates around the state, the biggest gaps and issues that have happened since this pandemic is the lack of continued communication with their clients, because they're pretty much on lockdown, and trying to find creative ways to get in touch with them. I know one tip I've told a few advocates when they have clients who don't have any money on their books, and the agency is still trying to figure out how to get a credit card on the phone system so that they can accept the calls, is that when they call and you have the automated message going, sometimes you can hear the other person on the line, the person that answers it, that's supposed to collect the call. And so I say use that time to explain, why you're not able to pick up. And then I've also sent out a template to advocates for a letter that they should be sending out, notifying them that they're still available and they're trying to find alternative ways to get in touch with them. But that's the biggest issue, is just trying to meet their immediate needs when having to switch to written correspondence when it takes so long, especially when they're actively in crisis.
Yeah, definitely. And I've heard that with the limited kinds of communication that are permitted right now, then that creates confidentiality concerns and privacy concerns as well, right? Correspondence, written correspondence, or even, video calls are not going to be set up in a way where that can be a confidential conversation, right?
Yeah, absolutely. Oftentimes they only have a certain amount of time in their day, like 30 minutes to an hour, to take a shower, do all the things that they need to do, make all the calls, and you have everybody else trying to make a call and they're at a phone bank. I have heard in another state that they've been able to work with their Department of Corrections to allow incarcerated survivors to do video conferencing in a separate room that's usually used for confidential meetings with attorneys. And so they've worked with the Department of Corrections to form that agreement that the local PREA coordinator or PREA compliance manager will reach out to the Rape Crisis Center to schedule upcoming, like reschedule all these meetings and make sure that they're in that space that you need help for that. So that's something that I wanted to bring up to IDOC.
Awesome, thank you. So again, folks on the call, any questions for our colleagues or for fellow advocates? Has anyone, I think we touched on this a little bit in our check-in meeting last week, but curious if anyone has tried to be in contact with any clients that you have that are incarcerated, or encountered barriers, again, respecting confidentiality and not revealing any identifying details. Someone says, I've had a video visit arranged with the prison. I also believe another coworker has as well with the jail. Okay. Yeah. For sure.
Something else I just wanted to share, I think I forgot to in the context of the presentation, but in case any of you, I mentioned our Know Your Rights presentations and just any presentations we do that are like sharing the work that the ACLU does. That's a service that we offer free of charge. So if you or any of your organizations, we can do them through Zoom until social distancing is no longer a thing. But if you ever feel like you or your colleagues or anyone would benefit from a presentation from the ACLU, please feel free to contact us and we can talk through that and make it happen.
Awesome. Another great resource. All right, I'm going to give folks a couple minutes to collect their thoughts and their questions.
No problem.
Takes a second to formulate their questions or comments, especially when you have to type them out. Let's see. Okay, I'm not seeing any questions in the chat. Is anyone having trouble getting unmuted or anything? Let me know. Okay. All right, someone says, I've had no problem setting up phone calls with individuals incarcerated at this time through DOC, and the people I'm working with are not on lockdown at this time. Just FYI, they are male. So that, okay, so men who are incarcerated, who are clients.
This is good for us to know too. Thank you.
Yeah.
Mm-hmm.
It looks like folks have been able to have some contact, so that's good. I feel like even just a week or 2 weeks ago, what I was hearing from folks is like we have total radio silence, and and haven't had any contact or any way to get updates. So
Alex, just really quick.
Yeah.
So I'm probably working with like 3 people, and then I personally know somebody, and I've had no problems. I don't know how it is with females, but these are all males. Setting up phone calls. No, they're not on lockdown. And then like providing video chat if you can get it set up. I mean, you have to have internet and stuff, but that's just where I've been at with it. And I've just called straight through to counselors, and it's been fine for me. So that might not be everybody's experience, but
yeah. That's good to know, though, that there might be some variation between institutions too.
Mm-hmm.
Yeah. And just for folks to know that there are those options, and not to just assume that, you know, if a place is on lockdown, that there's no possible way of getting in contact. But yeah, and then if folks are having barriers, then definitely, you know, get in touch with us, get in touch with, you know, folks at the ACLU. We can try and connect you with either, you know, someone in the Department of Corrections who can maybe get you some more information, or, you know, ACLU folks, you know, with ways to advocate more systemically. And sometimes, even if we're not able to, you know, have business as usual, confidential, you know, meetings with survivors who are incarcerated, you know, we can still engage in some of the systemic advocacy to try to improve their experience and their conditions.
I had a question. I was wondering if anyone has heard of anything cool or creative happening around the country in terms of advocating for incarcerated survivors, or just what's happening with incarcerated people in general. Good news. I want some good news.
That's a good question. I mean, in Iowa, we're on a little bit of an in-between place of, we're not on total quarantine lockdown like other states are, you know, so yeah.
I can sort of speak for some of the internal work that's happening with the ACLU, sort of like on a national level, and with all of our affiliates sort of being in conversation with one another. I mean, our affiliates are always in conversation with one another and with national, but I think that's been increased a lot in the context of the COVID-19 outbreak. And the letters that we've sent and the work that we're continuing to do is a result of not just our affiliates' work, but also the work of all of the other affiliates around the country, of national, of partner organizations in Iowa and in other parts of the country. So I think I know things are not great right now, but I am inspired by like the amount of collaboration that I've seen happen with people and organizations coming together around this, and making sure and trying to support people who are incarcerated and protecting their health and safety as much as they possibly can.
I know that we serve Iowa and Illinois because we're right on the border, and I know some of our Illinois systems had released people who were not violent offenders, and we were able to get them some services. I had that to see that we were able to.
Emily, I'm sorry, can you speak up a tiny bit and repeat what you just said?
I can try. Let me move the thing closer. Sorry. Can you hear me now? It's better? Okay. We work with both Iowa and Illinois. We're right on the border. And so we had a couple of our Illinois systems that we were working with release several nonviolent offenders, and we needed to figure out how to get them some services pretty quickly. But we were already working in those jails and prison systems, so we were able to get them hooked up with some assistance and some resources, and get them some safe housing and So that was a really exciting thing to see a lot of the advocates do. I know some of those advocates are on this call and could talk more about it, but I know that we have done that, and that's been hopeful in the midst of all of this.
Alex, really quick is, so I've been doing like work with incarcerated people for some time, well beyond COVID. So I would say that this one thing that this would show people is to really make connections with institutions before something like this happens, because I think that's why I've had better luck engaging with people, just because I already knew somebody in the prison system. So I think that helped a lot. So.
Yeah, absolutely. The value of relationships, and yeah, for sure. I feel like we talk about that all the time at all of our meetings, and you know, a lot of our especially homicide and other violent crimes programs are newer. You know, I mean, yours is attached to an older program, so you have kind of the benefit of that. And so yeah, sometimes it just takes that time and that effort and energy to build those relationships over time, and it pays off in times like this for sure.
Something cool that I've heard about that I know it's over in New York. I don't know if it's the New York Coalition, but an advocate that was sending letters to their clients, notifying them that, you know, they won't be able to do in-person meetings, but they're going to try other ways to maintain communication, had also attached this creative distractions like packet for them, and then it has, you know, like Sudoku and what's the other thing, like crossword, but it's like intentional, and like art prompts and writing prompts and things like that. And then they also, their organization or agency decided to create this PREA COVID newsletter that's just a 2-pager that I think they update like monthly to send out, to make sure that they're also getting the most like up-to-date information on what's going on and how services has shifted, which I think is really interesting and cool.
Yeah, I think that's super cool. I love that idea of sending survivors, if we can, you know, reach them through the mail, not just official letters about, you know, how our services are going to look right now, but also, you know, self-care things, or, you know, ways for them to constructively or creatively pass the time. And yeah, I love that idea. Absolutely. Any other questions, comments, experiences, ideas, or creative things that you've seen? Nicole says, I use the email option a lot too. We just add funds to their account. Okay. Yeah, because that's a barrier that we've seen, right, of people not having enough in their accounts to correspond with people. So that's definitely an option. Yeah. Awesome. I'm going to give folks just another minute or so to either pipe up or type in the chat. I'm cutting them off, but I think we've gotten a lot of good information. Don't want to draw it out if people are feeling about done. But anyway, thank you to Erica and Damonte and Nadia for sharing all of your awesome information, and to everybody else on the call for sharing your experiences and your strategies. Really appreciate it. Hopefully this was helpful to folks who are trying to think of creative ways to support survivors who are facing these unique barriers. All right. I see some thank yous in the chat. Awesome.
Yeah. And thank you all for having us. And if you like think of things after, any questions that you have, please feel free to send those our way. We're happy to answer those.
Awesome. And I see you put the links in the chat, so I can copy those and put them on the video that I sent out afterward. Perfect. Awesome. All right. Well, everyone, take care. Appreciate all the work that you're all doing. Stay warm on this cold, snowy April day. Thank you for all that you do, and have a great rest of your day.
Thank you all. Have a great day.
Thanks, everybody.